I was inspired at an early age. It was a rainy day soccer field. I was playing and tore my ACL. I was, I think 13 or 14 at the time. A month later, I think I went back in and had my first ACL surgery. Unfortunately, it didn't go great. I got an infection post-op. I was in the hospital for about a week. So I got to know my orthopedic surgeon very well back then. I liked what I saw. I liked the environment that they were in. After a couple of years of music school and college, I realized, hey, this is a lot of fun, but it's kind of hard to make a good living at this. So I kept the music career on the side, decided to go to medical school at that point. Did that up in North Carolina, came down to Mississippi where I did my fellowship in sports medicine. Did an extra year after my residency in sports medicine. Had met my wife in college. She was from Atlanta, and that kind of drew us back to the Atlanta area. And that's where I've been in practice since 2003. So I actually joined Piedmont Orthopaedics by Ortho Atlanta back in 2015. So my areas of expertise really came after my orthopedic residency. I did a fellowship, dedicated a year of sports medicine and arthroscopy with a heavy attention to sports shoulder injuries, degenerative shoulder injuries, and then sports and degenerative injuries of the knee as well. Probably did over 1,000 cases doing shoulder work, 1,000 cases doing knee work in that 1 year with some of the experts in the field at that time, and still are experts today. So for me, it's the degenerative shoulders, it's the rotator cuff tears, instability in the shoulder, along with like ACL and PCL tears in the knee, meniscal tears, and then cartilage damage in the knee as well. I think back probably 10 years ago, I had a lady that came in after we'd done a shoulder replacement, and she hadn't been able to move her shoulder or do things with that arm for 20 years prior. And she said the best thing that she could do after doing this was actually play with her grandkids, lift up her grandkids, and be the grandmother that she always wanted to be, because she didn't have pain and she could use the arm like a normal grandmother could. So that was one of the first times it kind of hit home that, hey, we're doing all these great procedures and we're trying to make a difference in these patients' life, but it's the simple things sometimes that really makes the biggest difference. As people get older, we're still active, we play different sports, we have different ways of injuring ourselves, but the injuries are still similar to what we were doing 25 years ago. Our techniques to fixing them are better, but it's interesting how pickleball has come about, and now that's one that we see a lot of injuries from. When the electric scooters came out, we were seeing a lot of injuries from that. So the trauma is still similar, but the way people get hurt, and I like listening to how they did that, because it kind of adds a little life to the injury. Through Piedmont Orthopaedics by Ortho Atlanta, we have a Epic healthcare system that you can actually make your own appointments online. You can call us on the phone. You can send us a text or email now, and all those methods will help you get into the first available appointment. And we always see patients at a week after surgery. I like to do wound checks. I like to make sure that they're wearing their braces appropriately or slings appropriately, and just make sure their pain's controlled. We also usually start a post-operative exercise regimen at about a week, whether it's a big knee surgery or a big shoulder surgery. We do want to get some motion, early passive motion, maybe not, we're not doing weights, we're not, doing heavy exercise, but we want to get that joint that's been worked on back moving again. I really think, the fact that we don't have a lot of redos of surgeries, our complication rate is very low. I think that's the thing I'm most proud about in orthopedics. I take that back to the training and learning how to do things the right way. Also, keeping up with new techniques, incorporating those new techniques into your practice patterns that work, and if it enhances something that you're doing, you do it. If it's just a new technique for the sake of being a new technique and it's not going to enhance your patient care, I'm always reluctant just to jump on the bandwagon for something like that. At home, it's a good family life and having 5 children. Boys and girls and a wonderful wife. That's the best accomplishment that I've ever done. The kids are older now, but we all like to get together. We usually go fishing together. We go down to Florida. We go to the Bahamas. We try to spend a lot of time on a boat if we can. It's nice to get rid of your electronic devices and just, stay up to date with what's new in everybody's lives and what everybody's up to, and how we can enjoy our fun time together. Hello, I'm David Stokes, sports medicine physician at Piedmont Orthopaedics by Ortho Atlanta. We would love to take care of any problems that you have, especially in the shoulder and knee realm. Come and see us, give us a call, give us a text. We'll be glad to get you in.